we start our discussion today. So everyone was asking last time that how to prepare MCQ exam, from where to start if someone is starting from scratch. So these are the few tips. First, you have to make a study partner. Like if someone is giving exam, you have to take study partner at least 4, 3, or at least 1 as well. It will help you to solve the recalls, because most of the time when you will solving the paper on the exam week, you will have a study partner, right? So a study partner will help you to crack the questions, because recalls are very breaky recalls, not the stats questions we are giving in the pool or something. So you must need a partner for that. One thing more, last time everyone was asking me that which book we have to follow, doctor, which book we have to cover. You cannot cover whole Levinson. You cannot cover the whole John Murtagh. So you have to just take these books just for the sake of guidance. Like if any topic, for example, obstruction topic is very weak, you just follow that topic from that book. Otherwise, don't need to follow every book wholly. For this reason, I'm asking everyone to please join the academy, because academies are giving you the whole precise material. One thing more, that reading will not help anyone. People ask and say that doctor, we failed the exam just because we have read these books, so many books. Reading just is for the sake of your own basic knowledge of the topic, not for the solving MCQs. For practicing or passing the MCQ level, you have to practice MCQs, which the med expert is providing like more than 5,000 BCQs of each topic, and they are also providing you the every topic with detailed MCQs. So you will not have any query whether in regarding of investigation, whether regarding of treatment, or regarding of any topics pathophysiology as well. Another thing is that most of the people, when they sit in the exam, they complain that they can't manage the time and the time is very short. Trust me, this is 3 hours of time is perfect, even more than that. I finished my paper 1.5 hour before, just because I practice more of BCQs. And in the last couple of the week, I just take like 4 mocks per day. So it will help me to speed up my exam. Med expert will provide you every mock test on the exam week that will help you in time management. But basically, it's 150 questions and you cannot go back once you click the question, right? So once you cannot go back, you can have to take the time on each question. For example, if you take the 10 minutes on each question, you will lose the time. You have to be that fast and that pace that you will take 2 minutes, least of the 2 minutes for each question. So if you stuck in any question, you will take the time. Like, for example, there are some questions, ECG questions, CT scans, the graph one. These are the questions that take time. You need to study it. You need to follow through it, because some statements are very long. Most of the time, AMC statements are like for 3 to 4 paras, more than that. But some paras in gynae and in graph, it's like 10 or I guess 11 line statement. So it will take time, like 5 minutes to just read for that. And then you have to go through the options and then you have to mark the answer, right? So manage the time accordingly by taking more mock exam more and more. Another thing is everyone is following John Murtagh. That's very good. John Murtagh's edition is like 2 years before. It's like 2 years or years back. You have to follow the guidelines. Guidelines are changing every month, or we can say like every week. There's another guideline. So must follow the RSGP's guideline. For example, you choose the topic according to the any topic like medicine. You choose esophagitis. Okay, everything was written in the John Murtagh. You just follow it for the knowledge. But what is the new guideline for the treatment? What is the new guideline for the investigations? You have to follow that. If you are doing one topic from there, so you have to do that same topic from the guideline as well. For this purpose, I just take a one topic in detail, and then after that we will discuss the MCQ. So today I choose the topic is lung or bronchial carcinomas. This is very important topic. This topic come from every aspect. Like this topic come from the medicine point of view. This topic will come from the emergency point of view. And this topic can also come from the stats point of view. Let me tell you how the question they will ask. For example, bronchial or lung CA is the leading cause of death after melanoma in Australia. Okay, this is the statistical point they will ask this question. 5-year survival rate is approximately 10%. Now sometime they will ask that what is the most common factor or what is the most common exposure for that. So cigarette smoking is the major factor. Also that occupational exposures are marginally, but the cigarette is the main cause of the lung CM. Secondly, we divide it into two types. That is, one is small cell lung carcinoma, another is non-small cell lung carcinomas. Okay, from small cell lung carcinomas, that is approximately 20% of all lung cancers. But for non-small cell lung carcinoma, which include squamous cell carcinoma, adenocarcinoma, and large cell carcinomas. One thing more, that among non-cell carcinomas, the most important and the very much asking question is about squamous cell carcinomas, right? Because it's 30% of all. Adenocarcinoma is as well, but smoking is a major factor for squamous cell carcinoma. Okay, so what are the clinical features? Mostly present between 50 and 70 of years. Greater than 90% are symptomatic at the time of diagnosis. If symptomatic, mostly advanced and cannot be resected. This is the most challenging of lung cancer. Sometimes they will give you the scenario according to the symptoms. Like, look, this is a cough, chest pain, patient come with the chest pain, wheeze, hemoptysis, anorexia. They will not give you the whole of the questions, like whole of the clinical features, but like few features. Most commonly, they will give the paraneoplastic syndromes, like patient having hypercalcemia, patient is losing weight, patient having malaise, patient having a Cushing syndrome or carcinoid syndrome. So they will give you a this, and then they will ask, what are your diagnosis? So these are all the symptoms, but they will not ask every symptom. But the key symptom is paraneoplastic syndrome. They will always mention in the exam that patient is having high calcium levels or hypercalcemia, patient is losing weight, or patient is having constipation or something. Okay. So what are the basic investigations? Sometimes the question will be asked like, what are the initial investigations and what is the best investigation and what is the investigation of choice? This is the three ways they will ask the question. Baseline, which is the initial investigation. In baseline, we include CBC, UCs, LFT, PTINR. Also, because in lung cancer, alkaline phosphate and calcium levels are high. According to the new guideline, alkaline levels are more sensitive as compared to calcium levels because calcium levels are high at that time when the bony metastasis already occurred. So alkaline phosphate level is also the sensitive tumor marker. This is the new recent guideline according to the RSCGP. Okay. The next thing is, after this is the initial investigation. If they ask what you will do initially, they will give you further option. Like they will give you CBC, they will give you X-ray, they will give you sputum, biopsy. They will give you more options. But people every time whenever they see the option in lung cancer, they will go for the biopsy. Yes, it is right, but they are asking about initial investigation. For the initial, you will always starting with the baseline like CBC. So if they will ask that CBC is done, what is the next important investigation? Then you will go for the chest X-ray. Like you have to go for the investigation line by line. You cannot jump directly to the fiber optic bronchoscopy. You cannot jump directly to the PET scanning. Every investigation where they will ask initial come on the CBC, and if they mention that CBC is done and the CBC is normal, what will be the next investigation? Patient is losing weight and something and something. So that is will be chest X-ray. If they say that chest X-ray is also done, there is some flaky, there's some haziness, then what will be the best investigation of choice? Then you will mark this option fiber optic or bronchoscopy. PET scanning we will do when the mets are in the body or when mets are in the bone. Fluorescein bronchoscopy is more reliable. Tissue diagnosis we will do when we just needed them, but mostly we even didn't do tissue diagnosis because fiber optic bronchoscopy is the best. We can take the sample and we will investigation of choice and we will diagnostic on the time. Okay, this is the important part. It will help you not in AMC MCQ exam, but in clinical exam as well. What is the examination, right? Examination basically they will sometime give that this area is blocked. This on percussion they're giving hard stony dull percussion. This is giving this that percussion. So examination is important from both point of view. While examining a primary lung cancer, sometime it may be asymptomatic. With the passage of time, it will be possible to hear a monophasic wheeze arising from a single area of obstruction. That means that area will be obstructed and the tumor is confined to that area. If there is significant obstruction of the respiratory tract, atelectasis will lead to deviation of trachea in the direction of the collapse segment. Okay, one thing more, how you will diagnose or how will you examine the patient having tracheal deviation? What findings or what will they will give in the question? Sometime they will give that person having tracheal deviation, and on examination, this is in finding is given. How you will examine the trachea that there is tracheal obstruction. You can see in CT scan, you can see in MRI, but on examination, you have to choose on the answers that you have to percuss the sternum. You have to percuss the sternum, right? On percussion of the sternum, you will feel that there is tracheal deviation. So you have to choose in the given options. The next is spreading his lymph node to the next supraclavicular regional areas. For this, you have to examine the patient for lymph nodes. Getting my point? This will every time giving in the question that this is his finding. What initial findings or how it will be spread to the other regional. So you have to check the lymph node as well. Another is sometimes they will give you that there is a patient having lung cancer and having splenomegaly. Everyone was seeing from splenomegaly, they will go for the malignancies of the abdominal. It's never been the malignancy of the abdomen if patient is giving get the symptoms of lung. Because in lung cancer, abdominal examination should be taking. It will give the splenomegaly as well. Although it is not a sign of liver metastasis, but still you have to do this examination. All this examination part will be given in the BCQs and they will ask. In my exam, they will ask for the sternum percussion. Okay, how you will define that tracheal deviation is present. Okay, the most important part which will ask again and again is treatment and the management. Okay, management of the CA is wholly depend on the cell type, anatomical stages, and performance status. Most of the cancers that will diagnosis will always have the palliative care, but there is also the treatment as well. Okay, you are asking for the tracheal deviation. There was a question in my exam that a person having lung CA and that this is the finding weight loss, having fever, and this person is having tracheal deviation. How you can examine? There was a question is how you will examine, and there are a lot of things are given. Like you have to see for the CT scan, you have to see for the PET scanning, you have to see go for the bronchoscopy, and there was option E. It was like you have to percuss the sternum. So they will asking for the examination. They will not asking for the investigation in the question. Meanwhile, everyone was seeing tracheal deviation. They put the bronchoscopy, and it was wrong. The answer was the percuss the sternum because they ask how you will examine. AMC just play with your knowledge. Trust me, they will play with that question. How will you examine? How will you investigate? People just blindly read the question and just put the investigation. If they ask what is the investigation if the tracheal deviation is performed, so you have to take for the CT scan or MRI to see the tracheal deviation. But if they are asking for the examination, you have to put the percussion of the sternum. Are you clear? Okay. For the treatment, we divided into two parts like radiotherapy, chemotherapy, and curative surgeries. All right. Curative surgery is infrequent as patients' general condition or impaired lung function often rule out pneumectomy or lobectomy. Sometimes the tumor is confined to one area. How we can say that it is confined to one area? As I told you in the examination, that it is only a single particular piece of that area. Other whole lung is clear. So we have to do for lobectomy. We cannot take out the whole lung because the CA is not spread to all of the lung. So we have to spare the lung. Chemo and radiotherapy in patient with a small cell carcinoma where there's limited disease localized to one side of the chest with or without mediastinal lymph node, we can give chemotherapy even with the radiotherapies. We cannot do surgeries in small cell carcinomas because it was very aggressive and 80% of the time when we diagnose, it is metastasized to the brain and every part of the body. So we cannot rarely do surgeries. We will go for the chemotherapy or radiotherapy. Okay, so for most commonly meds found in the brain, so we will do prophylactic cranial radiation is often offered. This was also the question in the mock exam as well. It's also a handbook's question as resembling to the handbook's question as well. That brain mets are found. What you will do to save the brain? There are a lot of questions that chemotherapy, radiotherapy, and most of the questions are giving the option like A and B both. So it is always prophylactic cranial radiation. Never go for chemotherapy. Chemotherapy is for the established disease, not for the prophylactic of the brain meds. Another thing is they will not ask you for the chemo names, but for the whole topic cover, I just mention it for your own knowledge. Many chemotherapeutic drugs that are effective against squamous cell carcinomas are cisplatin or carboplatin with etoposide. Most regimens are administered over 1 to 3 days every 3 weeks. Even improvable survival rate for this is 12 months in non-squamous cell carcinoma. Because as I told you, small cell carcinomas are very aggressive. They will just rapidly spread. So only for small cell carcinomas, for survival rate for them is 12 months. Okay, for when the tumor is extensive, like it will leading to out of the chest wall and chemotherapy fail, then we will go for the radiotherapy. Radiotherapy for the extensive lesions, right? If we are going for radiotherapy and chemotherapy, most of these drugs are also causing the symptoms as well. Like drug toxicities are also commonly asked in the question as well. And in the AMC exam as well, neutropenic sepsis was most commonly asked question. What are the drug toxicities or what are the chemotoxicities? One is neutropenia. Another is nausea, vomiting, and diarrhea, hair loss. These are the very common symptoms. But sometimes they ask that patient is on the chemotherapy, patient is having cancer, patient is having this, and come with the fever and rigors. Most of the people was putting the answer that it is due to the lung CA. It is not due to the lung CA. Lung CA is already treated by the chemo. So patient is on the chemotherapy, right? So we have to take for the neutropenic sepsis. That's why I mentioned over the symptoms, fever and rigors over there. Lastly, if the patient is we have given everything and patient is very febrile, having 85 years of age, we cannot do chemotherapy, we cannot do surgery, we cannot even do any giving medicines. What we will do? We will go for the palliation. Palliation for which symptoms? Okay, dyspnea, cough, hemoptysis, and chest wall. For dyspnea, most of the people were taking the answer that dyspnea is like hypoxia. No, dyspnea is just because of the anxiety a patient have. Dyspnea is just because of this, so we have to give sometimes opioid. Remember for this question, when you will solving the handbook, whenever you give the opioid, there's always a constipation. So prophylactically give electives as well. Whenever you are giving opioid, you have to give laxatives. Another thing is why we are going for palliation of these things, because these symptoms are very distressing. Cough, for cough, you have to give the cough suppressant syrups. For hemoptysis, you have to see rule out if there is spreading more of the sites or not. For chest wall pain, you have to put the patient on NSAIDs or you have to put the patient on morphine 3 times a day. This is the palliative care for the most of the cancers, right? Okay, so I have a question. You guys first answer me and then I'll tell you the answer, right? 65 years old male presented with abdominal pain, polyuria, increased thirst, and constipation for last 1 week. He has past medical history of smoking for last 30 years, 1 pack per day. Chest X-ray show a small nodule in right lung field. Blood tests show normal full blood count, normal urea electrolytes, and high serum calcium levels and high alkaline phosphate level. What is your diagnosis? Anyone? TNM classification is for few questions. It's like for breast cancer and for few cancers, not for everyone, like prostate one. Okay, I guess everyone done with the answer, and mostly people, I guess, answer A. So the answer is C. Tell me why you guys choose A. People who answer A, tell me why you guys choose A. It was the first slide I told everyone from the stats. I even emphasize on that slide that please do the stats. They ask a lot. Even I mentioned the percentage as well. Okay. One thing is, I told you that small cell carcinomas are very aggressive, and 80% of the time they are diagnosis, they have mets, right? They already have mets. They mention that mets are in the brain, mets are in the bodies. They also even sometimes give that this is the DEXA score is this and that, right? But I told in the start in the slide that squamous cell carcinomas are the leading cause. They are the 80% of the cause of the lung cancer. I told you that do stats. Stats are important. 20% of the lung cells are small CS and 80% are the squamous cell CS. Among them, 30% the squamous cell carcinoma. And it is mentioned in the exam that it is this person is smoking. The percentage of adenocarcinomas, squamous cell carcinomas are same, but the difference is adenocarcinomas etiology is not the cigarette. It is mentioned that this person is smoking from 30 years. Shall I go to the back to the first slide or you guys clear?
Go back to the first slide.
Okay, see this slide. Small cell lung cancer, which account for approximately 20% of all lung cancer, right? Non-small cell carcinomas, 80%. Among them, squamous cell is 30%. Adenocarcinoma is also 30%, but adenocarcinoma's cause is not the smoking. It is mentioned in the slide that the person is smoking. Getting my point? Everyone is clear? Okay, so this is the topic. I have another more questions to solve, which is out of this topic, but is a general topic, how to solve the MCQ in exam, right? I will upload the list for the causes of what are the causes of adenocarcinoma and what are the causes of squamous cell carcinoma. There is not only a one factor, but smoking is the main cause of factor for squamous cell carcinoma. So I've mentioned this. For adenocarcinoma, I will mention the list as well, and Asma will forward you, right? Okay, so this is another question, but it is not related to the previous question topics, right? 45-year-old male presented to your office for his 3 yearly fasting blood sugar, which is check is normal. He has blood pressure 110 by 80, heart rate is 89, saturation is 98 on room temperature, no oxygen needed. Respiratory rate is 14 per minute. He is non-smoker and non-alcoholic. What is your advice to him? Okay, this is the question from the guidelines in that the red book. Dr. Fatma, why you choose option E? Okay, that's pretty fine. I think most of the people are giving the correct answer. So this is the question from Red Book, and these are the questions which will come in exam and people getting the different questions. Like in my exam week, I have the paper on last day, so we are getting the more recalls. But this Red Book questions are totally different, and these 25 questions from Red Book and this 25 questions are different to every person. We 11 persons give the exam on last day, and we 11 persons get the different question from this Red Book. Okay, so vitamin D guideline is according to the guideline, vitamin D level we will check when the patient is having any symptom, right? I just giving a very normal scenario. Patient is having very perfect blood sugar, having very good blood pressure, and even the heart rate. Everything is normal, right? So according to the guideline, if patient is no comorbid, this patient is perfect, having no comorbs, no diabetic, no hypertension. From 45 years, we will check serum cholesterol every 5 yearly. From 40 years, we check fasting blood sugar every 3 yearly. And from age of 16, we have to check blood pressure every 1 to 2 yearly. This question come in my exam according to asking for the blood pressure, because everyone AMC know that everyone will have to even memorize this about the cholesterol and about the diabetes, but no one will study about the blood pressure level. So I also don't know at that time that you have to check the blood pressure from the age of 16, 1 to 2 yearly. This guideline is according for the non-comorbs, right? So you have to study the red book. You have to see the red book for the person who is having no comorbs, person having comorbs, and person having severely comorbs. Getting my point? Okay. Another question. 54-year-old woman comes to a clinic with right supraclavicular firm swelling. Yes, I will share the about the red book. There is every guideline mentioned over there. 54-year-old woman comes to a clinic with right supraclavicular firm swelling. She smokes 15 cigarettes per day and drink 1 to 2 alcohol drinks per day. What will you do next? I guess everyone answer surely. So, people who are putting the A, what's in your mind? Like this scenario is not even giving any breast symptom. Why you are going for mammography? Just write it down in the message, please. Okay, so the answer is E. No. It's not the explanation. Look for this. If it is giving for left supraclavicular means any abdominal malignancy. So you have to go for colonoscopy, right? If it is giving any axillary lymph node and breast symptoms, then we will go for the memo. They will not asking for the routine one. Also, if they are asking for the routine one, so routine one will not start from the age of 54. Getting my point? Even in a normal person and not even in the having uh, any disease, right? If they are giving the simple of GERD or peptic ulcer history, then we will go for the upper GI endoscopy. If any cough, weight loss, or paraneoplastic symptoms, then we will go for the bronchoscopy. This in this question, they are also giving about the cigarette. They are also giving about the alcohol. They are giving every symptoms, but you have to think about it that head and neck tumors also will go for that area, right? Nasopharyngeal, even the neck, they are also go over there. So we will first go for the FNAC. I'm emphasizing you guys, please see the question. They were asking what will you do next. They are not asking for the best. They are not asking for the diagnosis. They will not asking that which tumor is that. They will asking you what you will do the next. Any swelling we have see around the neck, we will go for the FNAC, right? We will not just go for the directly CT scan or for MRI and for bronchoscopy or putting any mammogram. What's the purpose of mammogram? Because breast cancer always first go for the axillary lymph node. It is right supraclavicular swelling. Getting my point? Please see this thing. Everyone was doing mistake by reading this not nicely because it will asking what will you do next. If they are asking me what is the choice of investigation, then you have to first rule out which CA is that. Okay? Or if they are asking that patients having this symptom, then you will go for colonoscopy. Or they are asking that which is the screening time, then you will go for mammography. But mammography, it's not putting it here because we will start if we have to screen for the breast cancer, we have to start it from the age of 40 or 45. 54 is not the age to start for the mammography. It is also wrong from that point of view as well. Please try to differentiate between the next, what is the initial, what is the best investigation, and what is if sometime this question was also done that FNAC is done, what will you do next? Like you have to do that stepwise steps. You have to follow the flow chart. First, you have to do for CBC, then you will have to go for FNAC. After FNAC, you have to see the CT scan. After CT scan, if you find any mass or something, then you will go for the place where it is. Like if it is in lung, then you will go for the bronchoscopy. Okay, the question you are asking, it's about it's a guideline. It's about not in the normal people mammography for you have to start for not for the normal people. It's for the this person is already having supraclavicular swelling. So this person is disease person, not the normal one. Screening time of normal people is different, and the person is already developed the symptoms. So there's no screening. There's all this diagnostic test, right? So mammography we will do for the screening purpose. This person already developed the disease. So no screening there. Shall we move to the next? Okay, 64-year-old male has recently been diagnosed with diabetic retinopathy. He has a long history of type 2 diabetes mellitus, hypertension, and hyperlipidemia. He smokes 20 cigarettes per day for last 20 years. Which of the following is the most effective treatment for his condition? Dr. Fatma, according to this, you have to follow the flowchart and you have to follow the question. Because in that question, they are just asking for the next investigation. They are not mentioning any type of tumor. Sometime they will putting that this patient is having this cancer and FNAC is done. what will you do next? Then the next will be the CT scan. But if they ask what will be the best choice, then you have to put that bronchoscopy, right? But you have to see the question that they are giving the malignancy or they are just asking for the random one. In that question, they are randoming asking for the question. The tumor is not defining which area of the tumor is confined. They are asking for the next investigation. Okay, I thought I put the very easy question and everyone is answering wrong. Why? Just read the question again. Okay, I guess everyone answered the question, but only few people, I guess three or four, answered the correctly. And I want to know why you guys are giving the answers about A and D, because I already mentioned in the question that patient is developed diabetic retinopathy. He is diagnosed, already diagnosed case. Tight glycemic control, blood pressure, these all are the measurements that you have to ask for the patient before developing it. But this patient already developed. He came with the developed retinopathy, right? So in this case, we have to give prophylactic photocoagulation to prevent further progression. They are asking it for the definitive and effective treatment. They are not asking for the initial. If they are asking for the initial treatment, we have to give the tight glycemic control. If they say that tight glycemic control is asked, what is the next? Then you have to give for ACE inhibitor or you have to give for improved blood pressure. But that person is already diagnosed case and they're asking for the effective and definitive treatment. Again, I'm telling you guys that AMC just play with your nerves like initial, definitive, effective. These are the lines they will put in the question, and the whole question was changed. This was the easiest question. Are you getting my point? They are asking for the definitive question because patient is having old age, patient is already developed diabetic retinopathy, patient having hypertension and hyperlipidemia. Like patient is totally compromised and also he smoked 20 cigarettes per day. So there's more chances that he will also develop hypertension retinopathy as well. For that reason, we have to do prophylactic photocoagulation. Other management, we have to say that you have to just control your blood pressure, ACE inhibitor, aspirin. These all are the measures, but these are side by side, not the main. The question is asking for the effective or definitive treatment. Okay, so this one is also the easiest question. Gynae from the gynae. Trust me, from the portion of psychiatry and gynae, they will not give that easy questions. But I'm just solving it for the sake of your practice or for the sake of your knowledge that how they will ask and how they will play with you. 25-year-old pregnant lady comes to your clinic with vaginal bleeding at 14 weeks of gestation. What is the possible reason to perform an ultrasound? Everyone take time and then answer. Okay, so most of the people answer to exclude topic pregnancy. All right, let's see the answer. This question is a bit tricky because whenever you see that there is vaginal bleeding, 14 weeks of gestation, everyone just putting the answer to rule out the ectopic pregnancy. You have to learn this table. This is also from the guideline. For ectopic pregnancy, we always go for the ultrasound in 7 to 8 weeks. For congenital heart defect, we will go for the 18 to 28 weeks. For neural tube defect, we will go for the 11 to 14 weeks. And for fetal viability, we go for 7th and 12th week. So this is the very nice guideline giving an RSCGP about this. You have to follow it. In this, they are asking why you are performing the ultrasound. What are the reason? So it is very logical question that we are performing the ultrasound for the to rule out the cause of bleeding, because patient come with a vaginal bleed. There's no other symptom. So two key points are given in the question. That's one is 14 week and the other one is about the vaginal bleeding. So you have to know which disease and which thing will be present in which week. You have to memorize this because sometimes they will ask for the ectopic pregnancy, sometimes they ask for the cause of bleeding, and sometimes they also change the option and ask that the cause of bleeding will be to have to see the placenta. There will be not the determining the cause to look for the placenta. Sometimes this option was also given because if I am giving this question, another person will have the same question, but the options are different. AMC will do this thing as well. So you have for solving the AMC MCQ, you first have to see the normality. They will ask sometime about the normality as well, not they are jump directly to the disease. And sometimes they just ask for the logical question. It is more logical than you have to think for any ectopic or fetal viability or anything else. So yeah, there's a whole chart which is giving about the weeks and which abnormality you have to see. So these are all the questions I have solved for today and giving you the insight about how they will ask and how you have to crack, how you will see about the initial, next, and best investigation. Any question up till now? Okay. One thing is, in the internet guidelines are available there, but you cannot summarize the guidelines by your own self. For this, you have to see or you have to take any academy who can give you the guidelines according to that topic, because you cannot do every topic from that thing, right? You cannot search for the guideline every do guideline, but the academies or any we will are providing you the guideline that will ask in the exam. We know which type of questions AMC frequently asking, which question is AMC rarely asking. So we just put in the notes about the recent guidelines. The topic I have given you on the lung CA are the recent updated from the guideline. In my time, calcium level was the only level that was given in the exam. But recently, they were asking about the alkaline phosphate because it is more sensitive as compared to the calcium. I emphasize you that don't revise the book, just solve the BCQs. If you have done your theory, you have to just do the BCQs. John Murtagh, guidelines, Red Book, these are enough for the study material. Just solve more of the BCQs to get more of the solving things and more of the know how they will ask in the exam. Any other question?
Thanks a lot, Dr. Nabira, for this amazing session, and your questions had really helped out students to know how AMC gives them questions and how they can approach towards those questions. And your tips and tricks were amazing. Let me tell you this thing.
Thank you so much. Yes, we will also giving recalls to our clients who are taking the course. We are giving everything. Even we are just make a session as well that every week we will just do a one topic, and after that we will take that topic guideline and like a journal club we will discuss that guideline. So our student don't have to suffer a lot and don't have to find everything on internet. We just giving everything on the plate. Just do it with us.
Yes, surely, very true. We are giving everything on the plate so that everybody can use that and excel their AMC exam. So just let me give you an overview about the courses that Medexam Expert is offering you. Then we can proceed with your questions. We are going to take your questions. We're going to answer all your queries. That's why we have, arranged this webinar so that we can talk to you in person. We can address all your queries out there. But let me just give you an overview about what Medexam Expert is offering you. So basically, we have designed amazing courses for all the students out there who are in their AMC journey. They are still confused how to start the preparation, where I can find all the material, how to find the Q bank. So we have designed these courses in such a way that if you are a student who is looking for preparation guide, so we have made this course so that you can get everything in one course only. You don't need any other thing apart from all courses. Like you don't need any other subscription, you don't need any other books, you don't need anything else apart from our courses. So all the students who are good in basic knowledge, so we recommend them the Recall Crash course, which is a short course. Okay, it is a 2-month course in which we are going to focus on all the unique questions that AMC is giving you. Like we're going to solve every questions topic wise. There will be 10 live sessions, and we are going to provide you with the recording and the PDF of every live session. So in case you miss any live session, we're going to provide you the recording. And we're going to give you a Q bank of 5,000 plus questions. And these questions will be from the past papers. They will be from the important questions. They will be from every aspect and every topic that you will be needing for practicing for your AMC exam. We are going to provide you with quizzes, with mini mocks, and in the end, we're going to provide you 3 mock exams that will be just like your real AMC exam, so that whenever you are appearing for the exam, before that, you can have a real exam-like experience. And also, we're going to provide you all the notes and flashcards that will really help you in your preparation. So the course has just started right now. If you want to join in, you are more than welcome. We have just started the course. So in case if there is any live session missed, we're going to provide you the recording so you can join with the rest of the groups. So just to share you about the schedule that we are following in the Recall Crash course, we have given you 10 live session, as I told you before, and we're going to conduct study group activities as well, so that every topic that you are going to prepare should be prepared very, very well. You don't have to revise again and again. We're going to provide you the mini quizzes for every topic. And in the end, like we have mentioned, you will be provided with mock exams so that you can, do your last minute preparations. So all the students out there who are not confident about their basic knowledge. So we recommend them a regular course who are starting their preparation just now. So for those students, we recommend the regular course, which is a long course of 3.5 months. And in these 3.5 months, we are going to cover every theory topic in the live session. There will be 25 live sessions. There will be amazing mentors like Dr. Nabira, Dr. Sumaya, Dr. Rajat, and Dr. Farhad. Every mentor will be there to guide you about the guidelines, about the theory, how you can prepare any topic. We are going to cover everything in the live session. So you don't have to open the books. You just have to attend the live session and your topic will be well prepared. Then again, we are going to provide you the recordings and the PDF of the live session, so nothing will be missed. So all the moms out there who have kids, who have busy schedules, who have duties, they can join this course and get benefit from this course. And we are going to provide you 3 mock exams, books, notes, flashcards. Everything is added in the course, so you don't need anything else apart from our courses. So now let's look at the amazing reviews. Those students who have joined our courses and got the benefit and they passed the exams and they have expressed their emotions that how well the course was designed for them and how the course has helped them in acing their exam. And you can see other reviews or May exam. So students who have appeared in the May exam and they got the result, they have shared their experiences with us. These are some of the reviews that I have mentioned over here. So this is a great news for all the students who are going to join for the regular course and the recall crash course. We are giving 40% off on all our courses, and you can avail this discount, and this discount is only limited till 20th of June. So if you want to avail the discount, contact our team. We are going to provide you the discount coupon. You can apply that and your fees will be changed. You will get 40% straight away discount. And we also do offer bundle offers. So if you join our 2 products like recall crash course plus exam session or regular course and exam session, you're going to get more discount. These are our bundle offers. So if you are interested in any of the course, contact our team. We are going to guide you how you can start your preparation, how you can take the benefit from the course, and how you can pass this exam. So now let me just quickly share you our website view so that you can know how to use the course. Let me share my screen. So basically, this is the website of MedExam Expert, where we provide all the study material to all the students who join our courses. This is the dashboard. So let's check the study material. So what we do is we offer courses, we provide Q banks, we provide mock exams, we provide free library that you can subscribe and get free material like free demo sessions, free quizzes, just to start your preparation. So let's dig into the courses. You have to click on user dashboard. You will find all the courses that you have joined. So let's take an example of the recall crash course. So this is our recall crash course. If you join the course, you will see this dashboard. In the course content, we have mentioned all the solved recall files of 2023 and 2024. You will find all the solved recall files with correct answers. If you want to go for the important recalls, you will find all the important recalls here. If you want to check and practice the recall questions, then you can click over here. You will find a lot of tests that you can perform, and every question will be with correct answer and explanation as well. So if you have finding any problem in any question, you will check the explanation. And in the notes, you will find all the flashcards of every topic like hepatology, gynecology, GIT, ENT, every topic mentioned in the flashcard. For that, you can do the quick revision. And important files, you will find all the important tables, important images, note tables that you want for your AMC preparation. In the test, you will find the question bank, and you can practice as much questions as you want. You can see we have mentioned all the Q bank in the form of topics. So if, for example, if you want to perform dermatology, you can just select dermatology and you will see the questions of dermatology only. So we have given all the topics that you will be needing for your practice. We have uploaded all the quizzes that will be topic wise that you can perform on the website. You will find another quiz section which contains the general quizzes. Like if your topics are prepared, then you can perform these quizzes. These are 40 in number. So these are basically the 5,000 plus questions that you can practice on our website. And in the recording session, you will find all the recordings that of the sessions that has been already conducted, along with the PDFs that the mentor will be using to deliver the lecture. So this is all for the course. And if we want to see how the QBank works, you have to click on AMC QBank and you have to click on practice now, and you can practice the QBank in two modes. That is the revision mode and the mock exam mode. If you want to just revise the topic, you have to click on revision mode where you will see the correct answer and the explanation with every question. If you want to assess your preparation, like how well I am prepared, I want to know how much score I can get after attempting the test, then you have to click on mock exam mode and you will find your score after attempting the test. Now let's look at the revision mode. In the revision mode, you can select number of questions as well. Like if I want to practice drugs and alcohol abuse questions and clinical oncology, I have to select these topics only. Then I will click on start and the test will appear in front of me. And with this test, I can attempt the questions. You just have to select the question. It will just tell you which is the correct answer. This is the correct answer with explanation as well, so that you can have an idea. Okay, if my answer is wrong, then what is the correct answer with explanation as well. So this was all for all courses. Do contact us if you want any details regarding courses. We will be there for your guidance. So now if you have any question regarding the courses, if you want to ask any question from our mentor, do venture your questions. We're going to try to answer all your queries. If anybody wants to join the course, you have to contact our team member. Shalim has shared his WhatsApp number. Just contact over there and we are going to guide you what will be the course, how to join the course. We will share the link with you. All the payments if you want to join the course, you have to click on the payment link or the website and you can join the course from the website. Dr. Ravi, just drop a message to our team member Shalim. He is going to guide you about the mock exam. And all the prices are in US dollars, if you want to ask about that.
Okay, doctor, for your question, I don't know about your country, which country are you in? But for as far as I know about that, in our country, like I belong to the Pakistan. In Pakistan, we have to do internship because after getting internship, there's a specific license number we have to put, right? For we have to put for AMC portfolio, that number will be available after doing the house job. So you have to done house job in your own country to get that license number. If your country is providing license number before doing 1 year of internship, that's super fine. But in Pakistan, we will get that license number after doing 12 months of internship or we call house job. After that, we get that number. Then we apply for the AMC portfolio. Before that, we have to do for epic verification as well. We have to need that number for epic verification and then we will go for the AMC portfolio. So as far as I know about my own country, every country have different rule. My country will provide that license after 12 months of internship. If some countries are providing that license after getting this final year MBBS exam, so you go for it. It's just needed for your AMC portfolio because AMC portfolio and epic verification require two things. One is your degree and another thing is your license number. Getting my point? No, we cannot apply on provisional license number. We can apply only for permanent license number. If they are accepting and they are giving a candidate number, then you have to see that if they are allowing you for the paper as well, because sometime objection will come later. Sometime they will not give the objection at one time, because at that time I apply on the provisional license, they will ask for the permanent license. Even the epic verification was not accepted at my time as well, and I give my exam in 2023 November. If it is assigning you, please make sure that after booking the exam and everything was so fine, or they will not object you as that this number is not the permanent one. If they are giving it and if they are changing it, that's very perfect for you. But make sure to see everything, check and balance, because sometime objection will come late as well. No, first you have to pay for the exam, and then after that, the seats will be open, right? First you have to pay, and then they will give you the slot that this seat is available for this time and this country.
So if you still have queries, we have mentioned our WhatsApp number. Contact over there. We're going to solve all your queries over there. So that was all for today's webinar, I guess, Dr. Nabira.
Yes, sure, Sma.
Yes, so let's end it. Thank you so much for all, joining us for today. We had a great time with all of you.
Hopefully, we will see you in the main course or in recall course as well.
Yes, surely, surely. Thank you so much, Dr. Nabira.
Anytime. Goodbye, everyone.
Goodbye, everyone. Take care. Bye bye.
Thank you.